In one case, she subsequently had a baby, and having a baby wasn't such a terrible thing for her, and she didn't suffer so much vomiting and nausea of pregnancy. There was no real pregnancy rejection in there. I find that the church is on your side, doctor, when you're working with a case like that.
That must be a recent ruling with the priest, because in fact, several years, they go to the priest about it. I've known of it, and they've come to me and cried about it. And the priest only tell them, well, you've got to have children for the church. That's just what you're for. And it just made it worse.
No, doctor, then it was some very badly raised priest or something, because there can be such things, I guess.
I haven't had one for a good many years, but I've had one.
I can only tell you that maybe these people that I sent to their priests have remarkably fine priests. The present-day priest, doctor, he's pretty well caught up on a lot of modern thinking. And he's an awfully well-educated man. He's much better educated than most of us think. I remember when I was a young man, I used to think that all he knew was churchly things and nothing else. Doctor, he knows human nature, and he is accustomed to handling these things. You'd be surprised. He's got answers for these things that he's been taught in school. I think that Notre Dame and places like that teach these priests so beautifully. I have the utmost respect for them, and for what they're able to do in such cases of dyspareunia. If it happens within the church, I send them to the priest. I don't think very often they'll hit up into the misunderstanding priest who'll say you're just a tool for the church to have more babies. That's a pretty cruel thing to say to a woman.
Right now, we're having these 25-year-old mothers with 5 and 6 children. And all at once they wake up. Here, I've got 5 children. What if I lose this man? I can't support these children. I don't want any more children. And they get metarages, for instance. We had a woman that's had a bleeding for 3 years. Because she was 26 years old and had 5 children. And her last child, she woke up to the fact that she could not take care of those children. If she lost her husband, why, she would be in a mess. And she fled for the 3 years, once a week. And she was curated, biopsies 4 times. She came to me and asked me how many times can a woman have a curette and that biopsy business. And it came right out that it was a defense that she wouldn't have to have intercourse as long as she did. And yet the priest tells them that they must have 2 years is long enough to not get pregnant. Now that's a priest out in our neighborhood here in St. Louis.
Oh, that hasn't been my experience.
I've had about 8 of those in the last 2 years.
That hasn't been my experience, doctor. I've had just the opposite experience. Maybe if I'd had that experience, I'd probably be very unsold on the priest too. But instead,
I'm sold on the priest. I've got some good friends, and I've kidded them about it. I don't just come right down.
No, the ones I've sent. Gee, I tell you, the ones I've sent to priests have come back, and their doctors have thanked me. They couldn't get over thanking me, and I've received also Christmas cards from these people for years and years afterwards, and tokens of their esteem in various ways. I don't know how to tell you how nice the people have been, and apparently because their priests have been so good. So my experience has not been like yours, doctor.
Don't you think that there are radicals in every doctor who doesn't care and just does the way he's told or the way he was taught years ago in school, a priest like that, and maybe you just ran up to this?
No.
I mean, it wouldn't be the average, but it might just be that particular one.
I don't think so. Any more questions that anybody wants to bring up? Yes, doctor.
I can tell you one thing about this business of using the contraceptives to prevent this. I really got a couple messes where they went ahead and got pregnant using their contraceptives, and then, boy, you really had a problem on your hands.
They weren't using contraceptives, doctor, properly. chances are. They never...
True. I mean, I don't know.
Yeah, you know, it's easy to say we're using contraceptives, but they're not using them. They follow instructions. If they don't follow instructions, they're not going to have any results from the contraceptives. I don't think that there's much chance. If they use the contraceptives properly, there isn't much chance of the contraceptive not working. I think that every time a person using a contraceptive gets pregnant, I think that there's an unconscious wish to get pregnant on her part. And that she's merely doing what nature is urging her to do, get pregnant. So you'll find that she doesn't use the pessary properly, or she doesn't use the vaginal jelly properly, or something prevents her. I think it's an unconscious wish to be pregnant that makes a person using contraceptive become pregnant. I'm so positive of that.
I had a fellow who was impotent when his wife used a contraceptive. And she had to come in several times to get additional ones because he cut a little hole in the diaphragm. They're now separated.
I have the utmost... Well, look, because I've kept you so late, we were going to cover a subject called the seal today. And it's 5:15, and I never dawned on me we were going to cover so much time with this sexual lesson. So I think we better let that thing go until next week and cover that at session 9. We can cover it completely. So I'll mark it for session 9. Just give me the outlines on the sexual problems today. And then we'll cover the seal and sleep and hypnosis next session. Gentlemen, that's an awfully important session that we're coming to. The deliveries in this state that you're going to hear about next week and that you're going to be able to do after next week is an even, well, I don't want to say this unless it's your thinking, but I think you told it to me the other night when we were together, that it's an even better state than the coma state. Isn't that what you were saying?
I think I'm very definitely of that opinion.
Not too many doctors work with the deepest phase of hypnosis known, and I love it. I love it. And I find that almost anybody can take that state. It isn't a difficult state to get. And if you learn the technique for obtaining it, and then learn how to use the state once you get it, I'll tell you what is possible to do with the state that you're going to hear about next week. It is possible to attach hypnosis to sleep, so that the person can be sound asleep and he's hypnotized. Then you give them a suggestion while they're asleep, for anesthesia, for example. And they'll hold on to the most beautiful, deep anesthesia, so that when they go to have the baby, for example, or surgery done, or anything painful, they're just like you or I, but they're holding on to a below the level of consciousness suggestion for anesthesia. And you deliver them both ways, while asleep and from post-hypnotically from sleep, isn't that right?
That's right.
So that you have their full cooperation, and yet they don't feel a darn thing while the baby is being born. In other words, it gives you an anesthesia which is even more intense, perhaps, than the coma anesthesia. At least it is equally as good. And it's general, isn't that right, Doctor?
Yes, as much as you want of it.
Just as much as you want. You can do wonderful things with it. And so it always amazes me when only a few doctors work with it. I think you'll like it. Although, don't let me unsell you on the coma, please. I'm not trying to. I merely say that if you want perhaps what is the most wonderful state of hypnosis that is possible in a human, you must know about this one that we're going to have at the next session. Well, I'm not going to hold you any longer. I think I've kept you long enough today. Since the year 1841, the word sleep has been erroneously used in hypnosis under the mistaken impression that sleep is part and parcel of hypnosis. It's easy to understand how this fallacious bit of thinking crept into international acceptance, for the early practitioners of hypnosis only observed the state from the outside looking in. They never examined it from the inside looking out. In fact, the early practitioners of hypnosis were scared to death of it, so far as accepting the state for themselves was concerned. Picture the hypnotic operator of that day and age. He saw the subject with eyes closed, looking to all the world as though the subject was in deep sleep. The deeper the operator got the subject into trance, the deeper seemed the sleep. As the patient relaxed more and more, his shoulders drooped, his head sagged, his body became almost inert, and if the patient was in a sitting position, he looked as though he was going to fall off the chair. But he never did. And no doctor ever could understand why he never did. Certainly from the outside looking in, the patient seemed to be asleep. Now first I want to show you what the old-time operator saw. Because in his improper use of hypnosis and giving the wrong suggestions, he created an appearance that looked altogether too much like sleep, and yet it wasn't sleep at all. I wonder if I could ask Dr. Littleson to come on up. I talked to your father in Chicago, and I told him I would try to work with you today and see if we couldn't solve this problem of yours, and I think we can. That is, I see no reason why we can't. First thing I want you to do, what's your first name?
Pat.
Pat. Pat, now cross your legs and get comfortable. Now, close your eyes. Now relax those eye muscles to the point where they just won't work. And when you're sure they won't work, test them and make sure they won't work. And then let that feeling go right down to your toes. And now when we do this the second time, Pat, you're going to be about 10 times more relaxed than you are this time. Now open your eyes. Now close them. And now really relax. Let every muscle in your body go limp. Just let every muscle go limp. That's very important, Pat. Now, the third time we do this, you will be able to relax twice as much as you've already relaxed. And if you followed orders, every muscle in your body will be limp. Now open your eyes, close your eyes. Now, relax completely, and I'm going to lift your hand and see whether the relaxation is there. Don't help me at all. Let that hand be just like a wet dish rag. You can't lift it, it's so relaxed. Now you're helping, you see what I mean? It's staying there by itself. And you're not helping me at all. If you want help, you do as I say, or I just have to send you back to your seat, Pat. Now just relax. That's what I mean. See the difference? Now, all right. Now it's that relaxation that you have now, which is all we need in the way... Oh, close your eyes. I didn't tell you. You're scared to death, Pat. Go back and sit down. I can't work with you. Sorry, I'll have to tell your dad I can't work with you. Now that's a pity. People might think when I'm showing them the deepest stages of hypnosis, why I will do that. If I can't get the latest state of hypnosis on them, how in the world can I get the deepest state of hypnosis? Do you see what I mean, Pat? How can I get the deepest state of hypnosis on you if you reject the latest state? And scared to death and keep opening your eyes and keep tensions in your hand while I say let them go out. So you'll just have to watch. And then later today, if you feel that you can do as the other people do, then I'll call you back up here again, but I won't unless you think you can. And you've got to decide that you can. I can't decide that for you. I'm over here. You're over there. Now, you do it the way you want to do it. If you want to help you learn how to relax. Doctor, you brought someone that you said takes suggestion very nicely, and then to show them very quickly what I'm trying to get at. Suppose we work with her first. Won't you come up and sit here? Now, Pat, you watch this. There's no reason why you can't do this, a young man. Your dad gets a beautiful state. I could take him right down to the coma. All right, just close your eyes. You know how to get eye closure. Now make those numbers disappear. And when I lift your hand, you'll be completely and thoroughly relaxed. Don't you help me. Just let it lay there, and I'll just lift that. Now let it be heavy. That's what I mean. Completely heavy. Now we got it. Now I'm going to give her the suggestions that the old-time practitioners of hypnosis gave to their patients. With every breath you take, you're going to get sleepier and sleepier, drowsier and drowsier. You're going to feel like you're falling asleep. Every part of you is going to feel like you're falling asleep, and you're going to get so sleepy. And now just watch how that head droops and the body sags, and you just feel so sound asleep. You just feel so sound asleep. And that body will just wilt. It'll get so loose and so relaxed, and you'll just be asleep almost in that chair. I say almost because I know it isn't sleep, but the old-time practitioner didn't say that. And he says you'll just be asleep in that chair, and just watch how that head just gets so tight that it just falls on your shoulders. Watch how it just falls there. That's right. It just falls deeper and deeper with every breath you take. Now this, from the outside, looks like sleep. But in a million years, it would never be sleep. Because hypnosis and sleep are two different things. I want to show you something. I have a stopwatch here. And the best way for anybody to tell whether it's sleep or not sleep is judged by respirations. The average person in good health breathes from 16 to 18 times a minute. In sleep, respirations go down considerably. The person who breathes at 16 to 18 times a minute breathes at 7 times a minute in deep sleep, 8 times a minute. Why don't you see that at the hospitals? Why, if a doctor sees less than 12 respirations a minute, he rushes over to the hospital because he thinks something is wrong with the patient? And I think every one of you have had that phenomenon occur where the patient says that it's down to 10 times or 9 times per minute, and by that time you're actually scared for the patient. Why does she always get a reading of around 12 or 14 when she puts it on the chart? Because of the fact that she has disturbed the patient when she reads his pulse, and she takes the respirations at the same time she's taking the pulse. Watch the respirations here. I'm going to start the watch on the... There's 1, 2, 3, 4, 5, 6, 7, 8. That means she's breathing quite normally at 16 times per minute, because that's in 30 seconds. We got 8. And we find her breathing normally, yet it looks just like sleep, and she feels so relaxed. If we ask her if she's completely relaxed, let's get her answer. Feel completely relaxed? What is your first name, if I may ask?
Marcella.
Marcella? All right, Marcella. I'm going now to show you how hypnosis differs from sleep. It's so easy when you're relaxed like that to cut down on the number of breaths you take per minute. At no time do I want you to be, in the least degree, not even an nth degree, uncomfortable. I want you just to take longer, deeper breaths at longer intervals. And you'll find you'll get sleepier as you do it. And I want you to let this continue until your breathing is down in number to what we get in a sound asleep person. So the contention is, you keep on doing that while I'm talking, Marcella, and then we'll take the reading in just a minute. You see, the contention of the man who writes all the books on sleep and so on is that when the respirations decrease in number, the person is deprived of the necessary oxygen, and sleep ensues. Now, this is such a completely fallacious bit of writing, and yet every doctor here is under the impression that that's what causes sleep. No. No, that will never cause sleep. Watch. By this time, you'll find that her respirations have decreased in number considerably. All right, I'm going to start timing you, and you breathe slow and easy, and notice that you're going to let it way out and bring it way back in, and just do it fewer times. And I'm going to start counting now. There, we'll start the watch now. Five in 30 seconds. That means she's cut it down from 16 to 10. At this point where she's going to sleep, she would be in a light doze if this were sleep. But I'm going to show you that Marcella can cut down her respirations even further by taking longer breaths and being just as comfortable as she is now, and yet decrease the count remarkably. And yet you will find that consciousness doesn't, well, I'm not going to make any statements. Let's see what happens. Marcella, just let yourself breathe even slower and easier. Get more comfortable. Get so comfortable. That's right. Now we'll time it, and you'll see that you'll be able to decrease that lower than you did before. Four breaths. That is 3.5. 3.5 in 30 seconds. Let's call it 4. She's down to 8 times per minute. At this time, were she in bed and going to sleep, she'd be falling pretty soundly asleep. Well, Marcella, you hear me pretty well? You're very comfortable, is that right? Haven't deprived yourself of an iota of oxygen, is that correct? Mm-hmm. That's right. Now notice, she can get down to the place in hypnosis where she is at a slower rate than a person fast and sound asleep, and yet notice that I can talk to her and ask her if she's asleep. All right, Marcella, just let those breaths come so easy now. Feel so relaxed inside of you that you just feel so good. I'll start the watch again. That's it. Notice how good you feel, and that's it. Now notice she's doing a very wonderful thing here, cutting down the respirations. Down to less than 3 in 30 seconds, which is 6 times a minute, and you can breathe normally now at any time you want to, Marcella, and you feel perfectly wonderful. Now, Marcella, at any time did you lose consciousness? Mm-mm. She lost no consciousness whatsoever. Now, suppose I was to say to her, Marcella, by this time, with the suggestions I've given you, you've gotten awfully sleepy, haven't you? And you can feel that want of sleep, can't you? I want you to fall asleep as you sit there. Just let yourself go completely, because you feel so much like falling asleep now. Now let yourself fall asleep. Get more tired with every breath you take. Just so tired and sleepy. Just, oh, if you could just fall asleep and just let yourself fall asleep. Falling asleep, Marcella? I want every one of you to try this experiment because I think the experiment is worthwhile. Are you asleep, Marcella? Are you asleep, Marcella? I don't hear you. Now, try this experiment. Although this looks like sleep, and in certain ways it almost feels like sleep. But is this the way you sleep at night, Marcella? Marcella, you've got troubled brows there, aren't you? What is the trouble? Now, you can open your eyes and tell me, but you will retain the state. So just open your eyes and tell me, Marcella. What was that troubled on your forehead? What did that say? You just wonder why you couldn't fall asleep, is that it? Huh? Was that what it was? Marcella, that was something a little bit unfair on my part. I knew that was going to happen sooner or later. That's what happens to everybody when they try to fall asleep in hypnosis. They feel so closely asleep and almost asleep, and yet they don't go to sleep, and they wonder why. And that's what was happening to you, wasn't that right? Huh? Now, let me show you. The reason for that is that hypnosis and sleep are two different, completely different states. So long as she has the critical factor bypassed and selective thinking established, those two things alone, in my beliefs and in my experimentation, show me that nobody who has that happen to them can fall asleep.